starting, and here is the timer, and here is the question, please. Right, so if you've read and understood, kindly begin your station.
Okay.
Yes.
Hello, good evening. Dr. Sunday, one of the surgical doctor. May I confirm your name and age?
Good evening.
So today I've been asked to speak to you about the procedure.
My name is Miss.
Hello,
Yes.
come again. I didn't hear you.
Hello.
Yes, please.
Yeah. Your name again,
Dr. Sun. Okay. Hello. My name is Mr. Max. I'm 66 years old.
Okay. Nice to meet you, Mr. Mas. Okay. Today I've been asked to speak to you about the procedure you're about to do. So it is called a colonoscopy.
Mm-hmm.
So, and may I ask you, what do you know? Do you have any idea what this means?
No, I just know my doctor has told me that since I've been suffering from passing blood during when I'm going to the washroom, so they have said that if I do this test, then I might be able to get some answers as to what could be the cause. I only know this about this test.
Okay, perfect. So
is it something dangerous, doctor? Should I be concerned?
No, not really. So I'm just here to speak to you about it. So basically, colonoscopy, as the name implies, means that we are going to pass a camera in form of a tube through your anus down through your intestine, so that you can be able to see what is going on inside your intestine. So basically, the tube is equipped with camera. So and that camera, the image is being relayed onto the monitor. So as we inside the tube, you can see what is going on live on the monitor. So, and from there, we can also be able to take sample of your intestine to send to the lab, so that we can figure out what is really going on with your intestine. Yeah, I understand you've had some complaint of bleeding and weight loss. So, but we need to be sure what is causing these things. And that is why we are doing this procedure.
Oh, okay. Is it going to be, it sounds very unpleasant. Will it be painful? Will I feel a thing?
Normally, yeah, it should, but we normally do this by giving you pain medication. Some people prefer to sleep during this procedure, so which should be done by our anesthesiologist. But sometimes some people may say, but I will advise that it's better if you sleep, because it takes away all the pain, and by the time you wake up, you're not going to feel any pain at all.
Oh, okay. Isn't there anything else that I can do other than this procedure? Isn't there any alternative to this?
Yes, there are other few alternatives. For example, we can take a scan, of the abdomen while we give you contrast. However, that one will not allow us to take sample. You understand? So, but this will allow us to look at what is happening and also be able to take sample. And also, we can also use two different kind of scan. One is a X-ray, one is called a MRI, and another one is like a jelly scan that they use for pregnant women, called ultrasound.
Oh, okay. So this procedure, this colonoscopy, it sounds very painful as well as very risky. Should I be concerned about any risks?
Okay, for the risk, of course, like any other procedure, it comes with its own risk. So, and the risk could be bleeding after the procedure. It could be pain, and the most serious one could be perforation when there's piercing or perforation of your intestine. But don't worry, these things rarely happens, and you are in the safe hands. Our surgeon, they are very experienced. So, and if this does occur, for the bleeding, we have the tube is also equipped with some instrument whereby we can use to stop the bleeding through coagulation and electrocautery.
It will be a
And
lot of bleeding. Will there be a lot of bleeding there?
no, not really. So it really happens, like I said, because the tube is equipped with equipment that can stop bleeding instantly.
Oh, okay. And do I have to prepare myself for this procedure anyway? Like, do I have to do something beforehand and after that?
Yes, of course. So, basically, that's one of the things I wanted to talk to you about. So, before the procedure, you need to prepare your bowel down for us. So, and this may include you need to eat certain food and also take a lot of fluid, and that will help to wash your bowel. That was days before the procedure. So, and we are going to give you some of the medication that you can take, but the food you need to take, there are quite some few, but they're going to give you a kind of a slip, which will contain the list of the food you need to take or that you need to avoid. But basically, taking a lot of fluid will help clear, your bowel.
Mm-hmm. Oh, okay. And I have some regular medications I take in the morning for my hypertension, for my blood pressure. So can I take those?
Of course, you need to continue your normal medication.
Hello?
If I may ask, what are the medications? Can you tell me the name of the
Hello?
medications? Hello? Hello? Can you hear me? Hello?
Can you hear us,
Yes.
Dr. Ulfat? Yes.
Dr. Sunday.
Yes, I can hear you now.
Yes,
Hello?
I
Can you
can
hear me?
hear. I cannot hear Dr. Sunday.
Hello? Can you hear me
Yeah,
now?
okay. So I take some, yes, I can hear you now.
Okay.
So Dr. Sunday, I take some regular medications for my blood pressure in the morning. Can I take those
Okay.
before this procedure?
Yes, you can take your medication for your hypertension before the procedure. But if I may ask, what kind of medication are you on?
Ask, what about
Hello?
aspirin? Yes.
Hello. Yes, I also take a blood thinner. That's what my doctor said. I take aspirin. I'm given aspirin in the afternoon, in the morning. So can I take that?
Okay. For blood thinner, we might need to
Hello?
stop. Hello, can you hear me?
Yes, I can hear you.
Yeah. For the blood thinner, you need to stop that before surgery, few hours before surgery. So, and for aspirin, also you need to stop it because it's also a kind of blood thinning, and we can
But
continue
you
that
see,
after the
my
surgery.
doctor said that aspirin is important and I cannot miss even one dose of it because you see, my father has died of heart attack and I'm quite concerned of this, right? It is given as a precautionary medicine for me. So if I miss that dose, isn't it going to be harmful for me?
No, it's not going to be harmful because we are definitely going to change the drug for you with another one that is safer during the operation. And as soon as you finish your surgery and we know it is safe to start aspirin again, we are going to do so.
Oh,
Okay,
okay.
good.
And okay, another thing, when will I get the result of this test?
Of course, like I said, the pictures and the video from the bowel, we can see that immediately. But for the sample that we are going to send to the lab, that might take like a few days to like a week or two for the result to come back.
Oh, okay, fine. All right then. And when do I have to come for this test?
Oh, wow. Well, as
Hello?
soon as you are ready, and I will
Mm-hmm.
discuss with my consultant to know the next available spot.
Yes.
So, do you have
Oh,
any other
okay.
question again?
Offer the information
Uh,
leaflet as well and number.
Yeah. Do you have any other
Okay.
question?
No, I'm okay. And if I have any problem, how do I get back to you? You
Okay, yeah.
will,
Don't worry. I'm going to give you an information booklet that contains everything we've discussed, and also I'm going to drop my number with the nursing staff, so you can call me if you have any other question or you want to reach out to me. So let me just summarize what we've been through. So today I'm speaking with you regarding your procedure called a colonoscopy, and I've explained what the procedure entails, and I also told you about the risk and what is to be done if we have any kind of complication, and also told you about other options that are available, and we also discussed what it is that you need to do before the procedure and how you need to prepare yourself for the procedure. And I told you we are going to give you a booklet that will explain everything for you that have been printed by the hospital, and I told you what you're going to do to your medication, which you are currently on now, before the procedure and after. So thank you for your time. I know that we are here to help you and to support you. So like I said before, I'm going to drop my number with the nursing staff, and you can collect it and call me or contact me for any further information. Thank you.
Oh, okay. Thank you so much, doctor.
Thank you.
Right, now the feedback. Good, it was good. Dr. Sunday, it's just that in the beginning you use the word that you have to put it through NS. You can use, yes, someone has also read a back
I know.
passage. Yeah.
Oh, back passage. Thank you. I was trying to remember but it didn't come. So
Yeah,
I just
all of them were telling you, yes, good.
no,
Yes,
I didn't
this
see
is
the
good.
message.
Yeah, it's
Yeah,
good.
back passage. Let me just
Yeah.
remember that.
Yeah, this is good because like you have to use as much slang or
Yeah, thank you.
language as possible. We
But
can
intestine, can we
suggest
say
to
food
take
pipe
opinion.
for the intestine? I think
Sorry?
people know about bowel.
Yeah, bowel
You
they
see,
know, they understand, but
yeah,
like
they understand
food
bowel.
pipe,
So that's like the
esophagus, and
esophagus. Yeah,
yeah.
bowel they understand. I think.
Yeah, bowel would have been
Yes.
a better word.
Yeah, just don't use intestine, Dr. Sunday. That's
Yeah.
my point.
Yeah, I used intestine
And
first, then I changed. Then I
just
changed it to
another
bowel
important
later.
thing, Dr. Sunday, like the STEM
Yeah.
is saying you to take the consent. Have you taken the consent? Have you taken the signature of this patient?
Signature. Yeah, I was about to mention that.
Yeah. I
You know,
missed that.
a
Yeah, I missed that.
It's
procedural
You
not
see,
that
signature.
counseling, it's taking the
It's
signature.
signature,
yeah.
consent.
So that means at the end, I will say, okay, so I would like you to also sign a consent form now, if
Yeah,
you are
it was the
okay with it.
consent form.
Yeah, so that will be at the end after summarizing. So I will just end with like, okay,
and
now
one more thing, you took 2 minutes extra because I
okay.
thought because there was a disturbance in the voice quality, she couldn't hear you and you couldn't get across, so maybe time got wasted over there. But still, like we're practicing almost every day, but we have to keep the time.
Okay, because I was just trying to flow with her because she asked question and
and
that
this is good because she was fully prepared. She had read the topic and she asked you all the questions in a very natural way. It was like conversation was very natural for both of you. I really liked it. It was spontaneous and natural. It was like it wasn't like I never felt as if you are practicing or there was anything. It was spontaneous and natural, so it's good.
Thank you.
And one thing, ma'am, just about the bowel preparation for this patient, as far I can remember, we want to advise that low residual diet, low fiber diet, and plenty of liquids 2 days prior to the procedure. And only liquid just 1 day before the procedure. And also there will be advised laxatives for this patient that will be marked in the bottle.
We discussed those laxatives as well last time.
Laxative and the low fiber.
And after procedure, I advise the patient not to drink alcohol in particular. So this
and we cannot the thing is that we cannot say low residual diet to the patient because the patient
low
wouldn't
fiber
know
diet.
what a low residual.
Low fiber diet.
So we have
low fiber diet.
Low fiber diet, we should say.
Yes.
No alcohol, low fiber diet, and
you called about the diet. Just mention about the time when she or he have to take
2 days prior.
2 days.
Yeah.
Good. This is good. See, that's when you all enjoy, when everyone has read the topic and has equal command on it. Very good. I loved it.
And if the patient is on aspirin, ma'am, I think we should wait for 5 days, like after
They have
stoppage
said
aspirin.
7 days
7 days.
in the notes.
7 days.
Yeah, ma'am.
Yeah, 7 days.
It says
7 days.
7 days.
Yeah.
Yeah, but Dr. Sunday, like he said, like we have to do this, but in that case, we have to take inform the consultant. Like also we can take opinion from cardiologist, because on aspirin, patient can't go under colonoscopy, right?
Yes.
Yes. Yeah, of course. There's
To be
risk
on
of
the safe
bleeding.
side.
And,
Yes.
yeah.
Yeah.
So the thing is, I didn't want to start talking on that because that will also take extra minutes trying to explain
Yeah.
stopping
Yeah.
7
It will
days. And
take extra minute.
so
You took extra, yeah.
yeah,
But then
so
you
I thought
have
of
to.
it that, yeah, so I tried to cut it short without talking in details
No,
about that.
don't cut short the important information,
Oh, okay.
but just
Okay.
practice saying it quickly,
Okay.
concise and to the point.
Okay.
Yes, please. Good. Yes. Anyone else want to add anything?
No, ma'am, it was good.
It was good. Yeah. Thank you, Dr. Ulfat. Thank you, Dr.
Thank
Sunday.
you.
Thank you, everyone. Yes. Should we move on?
Yes.